On August 6th, over 60 retired Athens-Clarke County Police officers, firefighters, and city employees filled the commission chambers to speak their opposition against recent changes to their retirement plan, specifically their medical coverage. The changes came as part of the recently passed ACC budget. City Manager Alan Reddish claims these changes will save the county nearly $1 million while still offering the same benefits. Retirees, though, are saying these savings come at the cost of care, service, and ease of use. They say they want what they are legally promised, the same health coverage they had when they worked for the ACC.
Receiving stuff in the mail 3 weeks that said they were dropping our insurance coverage. We were going to have to go with this extend health.
So before this, you had free coverage from the city?
From the city, that's right.
And that was 3 months ago.
I was retired under what they call a golden handshake. They wanted to get rid of the top echelon, so to speak, and so they gave us a retirement. I didn't really want to retire. I was 50 years, just turned 50 years old. But somebody come out and told me, said, if you don't retire, you'll lose your health insurance on your wife later on. Sort of threatening there. I thought about it and I said, well, I can retire now. So I went ahead and retired. But look at here. The government will continue the employee health benefits which are currently in force at this time at no cost to the employee until the death of the employee. Wow. Extend Health has 4,800 employees. You call one number and you get the next one available to talk with you. You don't sit down and talk to nobody face to face. You accept what they offer by mouth. You don't see it. You don't know what you got. It's ridiculous taking the taxpayers' money of Clarke County, sending it out to Texas and Utah, and to be used by these people out there. Well, we have insurance people right here carrying the same coverage that can sit down and talk with you face to face and come up with a solution that would be better for you. I hadn't been sick. I'm one of those fortunate people. Yeah. But there's people sick in this county. The workers are old. Yeah. They're Alzheimer's. Mm-hmm. We got one at Grandview Nursing Home that's lost 2 legs and part of an arm and getting Alzheimer's. Wow. Who's taking care of him? Yeah. Yeah. Have they even went over and took time to call in for him? Right. Have they done what's right? And they hadn't done what's right.
And those who don't know me, my name is James Alfred, and for the last from late 80s until I retired in 2002, I was the HR director for Athens-Clarke County. I look at it, this is not what we told them. We told them that they would have free insurance, same as employees, for the rest of their lives. This is not that. $150 a month would not cut it for these people. I'm so sorry that you started to do this, and I don't know, most of you know better, but I don't know why it came from. I talked to you, Nancy, and I've talked to a couple other council members. I hope y'all, these people don't have no computers. Most of them don't like phones. It's just not a good deal. I've been looking at this Advantage program, and it's not. So I would beg you to keep my promise, because some of them might read some letters that I signed. Yes, I did, because we've told employees that when they retire, whatever they had when they retired, they would carry it with them to the rest of their lives. Please honor that, because if not, you got a lot of people here that you're letting down. Thank you.
We also believe that this action is a poor way to treat all of these older citizens who spent most of their lives working for our county. One group of over 130 employees was given a legal contract 20 years ago. Golden handshake. All of you have a copy of that on before you. Line 5 says that we would have the same insurance till our death. We ask that you would do what's right. One of us could be your father or your mother. We could be your grandfather or your grandmother. Would you treat your grandmother and your grandfather the way y'all trying to treat us?
At the age that we are now is the age we're going to need our benefits, because we're over 65, so therefore we're going to have health issues. So I ask you to please rethink this issue. If you must do this, do it to the ones that come after us, not the ones that's already out there on that limb.
My name is Joe Walter. I retired from the Athens-Clarke County Police Department 10 years ago. Started with the city of Athens November 7th, 1974. From the very beginning, paid insurance upon retirement was a promise, both verbal and both written. Retired now, like all these other folks, for all these years, we kept your streets as safe as we could. We put out fires. We cleaned pipes. The various people that are represented here tonight, they picked up trash. They purified water. We did what we were supposed to do. We held up our end. And now you've hit us at a point where we are the most vulnerable.
We protected you all. We need you all to protect us now. Thank you.
Thank you, Mr. Hart.
I'm just very, very interested in making sure that for people like myself who would not feel comfortable, and our mayor said that making those decisions over the phone was not easy, that there is that safety net that I think you believe is there. And I would love to know that it indeed is, that for those who are unsure, that they can sit down with a representative of the company or HR and go over the various options face to face and leave there with a good understanding of the program they've bought into. And is that what you're telling me is happening?
I'm telling you that they are required to sign up. Either they can do it online, or they can sign up by having a telephone conversation with an agent person or a representative that will take them through as much conversation as they want.
If I don't understand, if I'm one of our retirees and I don't understand that person on the other end of the line, can someone in HR sit down with me?
And we have done that, what you just
Okay.
described. We have tried to interpret some information for certain employees who are retirees who say, I'm not sure I understand this.
Sure.
We have done that and will continue to do that. I don't want to give the impression that we're going to meet with 300 individual retirees and sign them up in the HR department. That is not what we're doing.
I'm hearing you say, and I just think I should reiterate it, is that the level of coverage for the retirees is not being lessened whatsoever.
Unless they choose to do that.
Unless they choose to do that. And there's no additional costs if they keep that same level of service that they've had for all these years.
Exactly. Now, I would not say to you that they can go and say, I want exactly the Blue Cross plan I got right now. But there are plans, including Blue Cross office plans, that will give them the same type of coverage they have right now. Now, will the forms look different that they go to file or they get from the company? Yes. Will they have to be a little more proactively involved in making decisions around their health care costs? Yes. That's going to be true of everybody in this country. Again, it's somewhat unfortunate it's beginning at this particular group that has not had a lot of experience in dealing with changes in health insurance program. But it works, the exchange works now because of the Medicare program that the federal government pays for. It doesn't work with the kind of savings that we're seeing with this program for active employees.